Question number 1. Which nutrient helps in tissue repair? Here, correct option is option B, protein. The pacemaker of the heart is characterized by. Here, right option is option D, SA node. That means cyanoatrial node. Question number 3. Universal safety precautions are a set of guidelines to protect the. Here, correct option is option A, healthcare workers. Question number 4. Growth hormone will be secreted by which of the following endocrine glands? Here, correct option is option B, pituitary gland. Question number 5. Breakdown of glycogen to glucose is known as. Here, correct option is option C, glycogenolysis. Question number 6. Inadequate pumping action of heart is known as. Here, correct option is option D, cardiogenic shock. Question number 7. What is the average weight gain of the neonate per day? Here, correct option is option C, 25 to 30 grams. Question number 8. What does a mixture of surfactant contain? Here, correct option is option A, protein and lipid. Question number 9. Which is the hormone that increases water reabsorption by increasing a water channel or aquaporins? Here, correct option is option C, antidiuretic hormone. Question number 10. Which of the following symptoms should be watched for a patient receiving a loop diuretic? Here, correct option is option B, weak irregular pulse. Question number 11. Which one is the second line drug of tuberculosis? Here, correct option is option C, amikacin. Number 12. What is the other term of recovery from an illness? इसका करेक्ट आंसर आप लोग कमेंट बॉक्स में ज़रूर लिखें. Question number 13. The removal of tissue from the pleural space is known as. Here, correct option is option D, pleural biopsy. Number 14. The final step of the purification of water on a large scale is. Here, correct option is option D, disinfection. Question number 15. What is the symbol of the element of tungsten? Here, correct option is option D, W. Question number 16. Which of the following is a heart-shaped pelvis? Here, correct option is option D, android. Question number 17. The time interval between infection of a suspected person and the appearance of signs and symptoms of the disease is called. Here, right option is option C, incubation period. Question number 18. Which is described as the powerhouse of cell? Very easy question. Here, right option is option C, mitochondria. Question number 19. Prions include. Here, correct option is option D, proteins. Question number 20. Who is recognized as the father of psychoanalysis? Here, correct option is option D, Sigmund Freud. Question number 21. Which cranial nerve is responsible for the sense of smell? Here, correct option is option B, olfactory. Number 22. Near sightedness is also known as. Here, correct option is option A, myopia. Question number 23. Oxidation among the following is. Correct option is option D, gain of oxygen. The most common type of stone that occur in nephrolithiasis is. Here, correct option is option B, calcium stone. Question number 25. The first menstrual flow begins at puberty and is termed as. Here correct option is option A, menarche. चलो गाइज फटाफट से कुछ क्वेश्चन रिवाइज कर लेते। ऑलरेडी टिक किया हुआ है क्वेश्चंस में। दिस क्वेश्चंस आर ओनली फॉर रिवीजन पर्पस, सो प्लीज़ डोंट माइंड। चलो रिवीजन स्टार्ट करते हैं। यहाँ पे बोल रहे हैं व्हाट इज़ द मेन फंक्शन ऑफ स्केलेटल मसल इन द ह्यूमन बॉडी। तो ऑप्शन ए इज करेक्ट है, टू जनरेट वॉलेंटरी मूवमेंट्स। Question number 2. Which type of muscle is controlled involuntarily by the autonomic nervous system? Here correct option is option B, smooth muscle. Question number 3. Where is smooth muscle commonly found? Here correct option is option B, in the walls of internal organs. Question number 4. Why does cardiac muscle not fatigue easily? Here correct option is option C, because it has numerous mitochondria. Question number 5. What gives skeletal muscles their striated appearance? Here correct option is option A, overlapping actin and myosin filaments. Question number 6. Which structure connects muscle to bones? Here correct option is option B, tendons. Question number 7. What is the functional unit of a muscle fiber called? Correct option is option B, sarcomere. Question number 8. Which ion is essential for muscle contraction? Correct option is option B, calcium. Question number 9. What is released from the sarcoplasmic reticulum during muscle contraction? Correct option is option A, calcium ions. Question number 10. Which energy molecule is directly required for muscle contraction? Here option B is correct, ATP. Question number 11. Why does rigor mortis occur after death? Here correct option is option B, because ATP is no longer available. Question number 12. What is the name of the connective tissue covering a whole muscles? Here right option is option C, epimysium. Question number 13. Which type of muscles show rhythmic contraction without consequence control? Here correct option is option C, cardiac muscles. Question number 14. Where does muscle contraction begin within the muscle fiber? Here right option is option B, sarcomere. Question number 15. What is the role of anticholinergic in muscle contraction? Here correct option is option C. It transmits nerve impulses across the neuromuscular junction. Question number 16. Which protein directly bind to calcium during muscle contraction? Here correct option is option C, troponin. Question number 17. Why do muscle need oxygen during prolonged activity? Here correct option is option B, to produce ATP through aerobic respiration. Question number 18. What happens when lactic acid accumulates in muscles? Here right option is option B, muscle fatigue occurs. Question number 19. Which part of the neuron stimulates muscle contraction? Here correct option is option B, axon terminal. Question number 20. What is the junction between a motor neuron and muscle fiber called? Correct option is option B, neuromuscular junction. Question number 21. What term describe the ability of a muscle to shorten and produce force? Correct option is option C, contractility. Question number 22. Which type of muscle tissue has intercalated disc? Right option is option C, cardiac muscles. Question number 23. Why does ATP production primarily occur within muscle cell? Here correct option is option B, mitochondria. Question number 24. Why are slow twitch muscle fiber more resistant to fatigue? Here correct option is option C, They have high oxygen supply and more mitochondria. Question number 25. What structure transmit action potential deep into the muscle fiber? Here correct option is option B, T tubules. Question number 26. Which part of the sarcomere moves closer together during contraction? Here correct option is option A, Z lines. Question number 27. What happened to the H zone during muscle contraction? Correct option is option A, it disappears. Question number 28. Which enzyme break down acetylcholine after nerve stimulation? Here correct option is acetylcholinesterase. Question number 29. What is the role of myoglobin in muscle cells? Here correct option is option B, binding oxygen. Question number 30. Where are multi-unit smooth muscles found? Correct option is option B, in the large arteries and iris of the eye. Okay guys, thanks for watching. Bye bye. मिलते हैं नेक्स्ट वीडियो में.